We're here with John Fox today, who is at the Ashland Community Hospital putting on a presentation on poetry therapy. Would you care to share a little bit about your project?
Sure. I'm here at Ashland Community Hospital to do two programs. One, this evening, which is Thursday evening now, we're going to show a film called Healing Words, Poetry and the Art of Medicine. And for many years I've been interested in the interface between art and medicine, in particular how it can be useful when taken into a hospital setting. It's very moving in that people are able to realize that it's not just about sort of, dealing with this, particular disease that I have, but how do I express myself as a whole person? And one of the things that I think the more enlightened hospitals are finding is that really aside from the technology, aside from managed care, that we don't want to lose track of the person who's actually there. And that another thing about this film, which will be hopefully on PBS this year, is that we have physicians speaking about why they feel the arts make a difference, not only in the lives of their patients, but in their own lives and their own practice of medicine. And so I've just been working for about 20 years with this. I worked at El Camino Hospital in Mountain View, California in the mid-'80s, and I've continued to find ways to share it. Work a lot in cancer support centers, both with people who are dealing with cancer and people who have a loved one who has cancer, who has died from cancer. And poetry, aside from other kind of ways of writing or speaking it, can somehow express emotions in ways that are unique. I've found that people who have never written a poem before in their lives, perhaps because of some loss they've gone through or a person they've lost or a challenge they've faced, find themselves writing poetry. And it's almost like a natural response. And I think if I can do something to help make that more accessible, then I really love that kind of work.
And I know you have to get ready for your presentation, but do you have time for one more question?
Sure.
Do you have one particular memory that stands out in your mind of somebody that you have helped with poetry therapy?
Yeah. In this film that you're going to see, there's a woman named Sally Harrison. Sally, and she had heart bypass and breast cancer. And in the film, we're really not there to say, teach her to write poetry, but to sort of find a way so she can have access to it. And at one point, she's telling us her life story, and she says something like, I sure am talking about myself a lot. And so I said, well, what if you were to write a poem called Talking About Sally? And she just, from that moment, she had 5 very short lines about how her illness had helped her to look at her life and decide that she was going to live a life that was more open, and that she no longer was going to let what she called avoidance and denial sort of keep her from doing that.
And deflects any mention of Sally. 2, when pressed, Sally minimizes and says, oh, I think these are things that everyone goes through. 3, Sally becomes more honest and will say, I'm not into denial, but I am into avoidance. 4, Sally realizes after sufficient physical catastrophes that avoidance and denial are killers. 5, Sally is now open about her life.
Poetry gives a voice to our innermost fears and joy. Art in all its forms, but carries us from illness and loss to hope and understanding. Under the leadership of Dr. John Graham Pohl, the Arts in Medicine program is exploring the use of expressive arts in medical settings. Not just paintings in the lobby, but artists in residence, working at the bedside hand in hand with nurses and physicians. CIIS is the first hospital in the country to fully support the arts as integral to their healing services. Arts in Medicine helps to transform the medical environment to one of color and inspiration.
Don't be afraid for me. Don't be ashamed.
Poet and teacher John Fox regularly visits Shands as a poetry therapist. John is a progenitor of the emerging Poetry in Medicine movement. John Fox and John Graham Pohl formed a friendship around their common study of poetry in a medical setting. How does the reflective art of writing help us? Does poetry heal?
Art heals by untangling the living threads of our being. Our dancing pulls loose the knots of sickness. Poetry reweaves our stories with deep truth. Painting covers the gray of disease with the colors of health.
I wondered why they didn't tell me. I thought they had lied. What will it be like? It's like a bad sunburn, they said. When my skin cracked and bled and no pain medicine could help, I wondered why they didn't tell me. I thought they didn't want to scare me, angry I'd been duped. Later, I realized perhaps they didn't know.
I like the honesty in those faces of the ill, the dying, whether child or elder or those of middle age. The gaze is soft, the lines of the faces not tensed into polite smiles. If the smile is there, it's genuine. And I like how the honest words erase the wall between patient and professional. All are people, humans being most nobly human in their striving to express, to say, to communicate something of what only each could speak, and only now.
She's got very low white cells. Just lots of different things we can't really explain. We have some. Right.